quite exciting, isn't it? I found out why. We were a bit nervous. It was the first one last time, the first live one on YouTube, and I've now found out why Helen Jones was a little bit nervous, because she said her father was logging in to watch. So, yes, there we are. We'll start off with apologies, and then we'll sort of do some introductions and one or two sort of things that are happening. So, apologies, please.
We've got apologies from Councillor Camis, Councillor Mary Dooley, Councillor Natalie Hoy, Aid Odelaide, Andy Smith, Abid Bartia, Chris Clayton, Sarah Jones is covering, Drew Smith, Councillor Yvonne Williams, Ellie Holston, Ian Little is covering, Julie Patton, Karen Hanson, Mark Powell, Caroline Green is covering, Stephen Posey, Tracy Allen, Darren Tidmarsh is covering, and Helen Henderson Spores from Health Watch Derbyshire. Thank you.
Any other that we know about? Yes.
Yeah, just to say, Councillor Mannion Brunt was hoping to get here, so she still might arrive, but if not, you could register. Apologies.
Thank you. Well, it's sort of said late items, but I don't know if it's a late item, but I think we're possibly up to do some introductions. But the introductions we'll do, we've got several substitutes. We've also got, on the local political scene, we've got some that are actually out putting envelopes through doors rather than being here at the meeting, I'm afraid. And we've got Councillor Webber will be standing down. Is Councillor Mannion Brunt standing down? Yeah, so that will be two members that are here, that would have been on the board today, and of course, Councillor Webb said that we have different people in. So, and of course, the biggie as well, we heard this week that John MacDonald is leaving the Derbyshire ICB and my vice chair. So, yeah, so it's a lot of changes, and we've also got our acting adult care and social care for Derbyshire County Council. Helen Coombs has joined us. She's taken over from Helen Jones for the time being. So it might be good if we just go around and sort of introductions, so that, but as I say, the next meeting we could have completely different people as well again. So, but if we could start over in the far corner, the leg. Would you like to start?
Sorry, I do apologise. Yeah, Will Legg, Director of Strategy and Transformation at East Midlands Ambulance Service.
Hi everybody, Stephen Bateman, Chief Exec for DHU Healthcare.
Hi, Christine Durrant, Executive Director from Chesterfield Borough Council.
Hello, James Moore, Chief Executive Health Watch Derby City.
Hello, Wyn Garnett, Programme Lead for engaging the voluntary and community sector in the integrated care system.
Hello, Chris Pienaar, Chief Executive Derbyshire Autism Services and Voluntary Sector Representative for Derbyshire.
Hi everyone, Kim Harper, Chief Officer at Community Action Derby and Voluntary Sector Rep Derby.
Darren Tidmarsh, Deputy Chief Exec at Derbyshire Community.
Sarah Jones, Exec Director of Strategy and Planning at Derbyshire ICB.
Sean Thornton, Deputy Director of Communication and Engagement for the ICB.
Councillor Roy Webb, Cabinet Member for Adults, Health and Housing at Derby City.
Helen Coombs, Interim Exec Director for Adult Social Care and Health for Derbyshire County Council.
Ian Little, Assistant Director of Public Health at Derbyshire County Council.
Kate Brown, Director of Joint Commission and Community Development for the ICB.
Ian Hall, External Advisor supporting the Integrated Care Strategy.
Duncan Gooch, GP, PC and Clinical Director, and here is a GP Provider Board Member.
Hello, Carolyn Green, Executive Director of Nursing and Patient Experience at Derbyshire Healthcare, and Mark Powell as Chief Exec.
Derbyshire County Councillor Neil Atkin, Cabinet Support Member to Carol Hart, and I'm only here as an observer today. Thank you.
No, thank you. Minutes of the last meeting. If we go for accuracy or any matters arising on page 1, page 2, 3, 4, 5, 6, 7, 8, 9, and 10. Everybody seems happy and no queries, so I accept those as a true record. Thank you. So if we get on now to the first one, which is a report of the Derby and Derbyshire Health and Wellbeing Boards. I don't know, is Derbyshire County Council going first? So Ian will take it as Ellie Holston, Director of Public Health, is on a conference, I think, or some training. So over to you. Thank you, Ian.
Thank you. So the report in the pack today provides a summary of the items discussed at the March County Health and Wellbeing Board. There's 3 specific items that I'd like to highlight to the Integrated Care Partnership this afternoon. So the first is the focus through 2023 for refreshing the County Health and Wellbeing Strategy. So the timescale for engagement and development is given in the report towards final approval in January 2024. The refresh of the strategy provides an opportunity to articulate the role of the Health and Wellbeing Board in taking forward key priority areas to improve the health of the population of Derbyshire, and it also allows an opportunity to align closely with the integrated care strategy and reflect the respective roles of the health and wellbeing strategy and the integrated care strategy. The second item to highlight is the review by the Health and Wellbeing Board at the last meeting of the draft integrated care strategy. The Health and Wellbeing Board welcomed this as an opportunity for joint working across organisations, and as noted in the report, there was a request from district and borough representatives for greater prominence in the strategy and to explore the contribution that they could make in terms of implementation of the strategy. And thirdly, the Health and Wellbeing Board also received an update on the development of the Joint Strategic Needs Assessment at the March meeting, and obviously that will be key in terms of providing evidence and insights to support informed decision making across key programmes of work, not only for the Health and Wellbeing Board, but also for the work of the Integrated Care Partnership and also within the implementation of the Integrated Care Strategy. There were a number of other update and information reports that were considered as well, and those are detailed in the report. Thanks.
Okay, Councillor Webb.
Yes, in the interests of accuracy, can we alter 4.3, the last bullet point, to say January 2024 for board approval of the final strategy, not January 23? Thank you.
I mean, I do chair that Derbyshire Health and Wellbeing Board, but I was out of the country, but I did join it in a hybrid way. It was quite a long meeting, a lot of presentations, and I have to commend the Vice Chair. He managed to only overrun by 5 minutes, which was excellent anyway. But there was an awful lot of conversation about the support fund, the Household Support Fund, and how that is being rolled out, and there's so many areas of grants and things, and people trying to get help out. And I think the biggest thing that we've found is making sure that people know what they can apply for and what and how they can be helped, because there's still an awful lot of people still do not understand, and it's trying to get that message out. So there were a lot of really good presentations, but I think that was really important one. And the joint needs assessment, it was quite funny when we're talking about that, because we really, with the districts and boroughs now on the Health and Wellbeing Board, they all do sort of different things, and it's coordinating so that we get the right information on that. But any questions on the Derbyshire Health and Wellbeing Board? No. So I think, Robin, you're going to do the Derby City. Thank you.
Thank you. So in the City, we met on the 16th of March, and you'll see in the paper that there's a summary of the items that we discussed. First of all, to draw your attention to a discussion of the Tobacco Control Health Needs Assessment. So this was a Derby City document that we were discussing, but there is similar work ongoing in the county, isn't there, Ian? And And we reviewed that, and also there was a request to take that item to the executive meeting for the ICP, which we're currently looking at arranging to attend that executive meeting with some feedback from the county as well on the progression with that. Just also to note that we discussed the joint health and social care all-age autism strategy, and we also looked at the plans for updating the Derby joint health and wellbeing strategy, and specifically for that we're looking at developing that strategy in partnership with the Place Partnership and also with the Health Inequalities Partnership as well, so that we can take the opportunity of our single geography to look at a single joined up strategy for all three areas for that. We also had a report from Healthwatch around the experiences of the LGBTQ+ community, and the board have requested an update on that to consider any improvements in that. And we had an update from the Health Protection Board, and specifically to note that the Health Protection Board approved the content for the ICS strategy as well. So that's to ensure that they are all aligned. Very happy to have. Oh, and finally, must mention that we noted that it was Councillor Webb's final Health and Wellbeing Board meeting, and to thank Councillor Webb, and also Councillor Webb, whether there's anything that you wanted to draw out from the meeting yourself as well.
Over to you, Councillor Webb.
Thank you. Yeah, it's been a pleasure working with the Health and Wellbeing Board since its inception. I think we started it in shadow form in 2011, and it's moved from strength to strength. I'm pleased to say that I leave it in a position of strength, and I'd like to thank all the participants in that Health and Wellbeing Board and within this board as well for the work that they have done to put health and social care and local authorities and the voluntary sector in particular together in an integrated care strategy. So thank you.
Thank you, Councillor Webb. Any questions on the Derby City one? No? Thank you. So we note those. Yes, I mean, yeah, we did more or less the same. I was involved in the shadow when we set up at Derbyshire, and yeah, it's gone through quite a lot of changes. And I just remember our first meeting, because we were deciding who should be on the board, we invited probably 120 odd stakeholders to a meeting and sort of said, you know, well, do you want, you know, who do you think should be on this board? And I was on a table of 8, the first table, and bear in mind 120, and I think all 8 people at the table felt they should have a place on the board. So it was, yeah, it was a bit of a challenge to thing, but I mean, I think, you know, as we said, they have progressed really well, and I'm pleased in a way that we've now got districts and boroughs getting involved, because sometimes they felt that they hadn't got any input, but they have, and particularly on the housing side, I think that, you know, they've got a major input, and so I'm pleased that they're involved now, so that is good. So if we note those papers, and we've now got, well, it was Tracy, so you're standing in for Tracy, yeah. Oh, yep. You've done the short straw, so we're going on to the integrated core strategy, and I've got a copy of them. Yep.
Thank
Over
you,
to
and
Kate.
I'm hoping you've got a presentation. And I'm very pleased to be able to present this and to reflect the work that's gone into it by a range of partners. I hope that comes through in the strategy that we're presenting here today. So the purpose of the presentation is that if you could, I'm not sure I can drive from here, can I? So the purpose of the presentation is to provide a brief summary and a reminder of the approach we've taken, and to summarise the key changes that we've made since the strategy was considered and endorsed by the ICP in February, and to request that the ICP recommends the strategy for approval in line with appropriate governance. So in terms of a reminder of where we've come, the journey we've been on, so we've had a working group and drawn through that working group from a range of the strategies and priorities across our system. And we've also felt really importantly, we've had a communications and engagement group involving Health Watch and the voluntary sector to develop that insights and engagement approach that isn't just around this strategy, but about how we work as a system, taking it forward. So that framework draft, and then we're now here thinking about strategy sign-off, but noting that it's an iterative process, and particularly in line with the guidance when there's any changes to joint strategic needs assessment, there'd be a need to review and refresh the strategy as appropriate. I could have the next slide, thank you. So a little bit of context, and people will be familiar with the conversations we've had here previously when we've brought this through, but just as a reminder that the current environment for health and care is, as we know, incredibly challenging on a number of fronts, and we can't then, develop the strategy in a bubble and ignore everything, but we can make real improvements and progress against our strategic aims and expected outputs by developing a more integrated and productive ways of working, addressing the constraints and opportunities documented in the strategy, and importantly learning from what we already do, and we feel that that strength-based approach is really important throughout the strategy, not only in how we support individuals, but also how we as a system work to draw on what we do well and to build on that. We tend to often focus on the deficits of individuals, structures, processes and systems, and we've tried to think really positively about how we can build on what we do well and celebrate in Derby and Derbyshire. Next slide. So quick reminder of the strategic aims that have been a theme and been approved early on in the process in terms of our focus of this work and our ways of testing back that we are delivering against those aims in all that we do. Thank you. And the key areas of focus, so if people remember, we've selected across that life course an approach that looks at an ambition around start well, stay well, and then age well and die well as a way of testing out the aims and how we're responding to population health and care needs. So we've said all through these aren't the sort of key priorities alongside with any prominence against any other priority. We know we've got a raft of things that as a health and care system we're delivering, but these are ways, they're very integrated ambitions that we can test how we're working together. And just a reminder, there's also a health protection section in the document that's been developed with the Directors of Public Health and includes the key areas of work and strategic actions that they have identified that require system support. So it brings those elements together. Thank you, Lindsay. And again, a reminder that we've focused very much in how we've approached this to think about how we deliver. It's easy to identify big priorities, big ambitions, statements of intent, but how are we going to deliver that? And we've focused in on the structures, governance processes that need to be there, that shared purpose, values, principles, and importantly, the behaviours that we display and how we work together. And then, and really crucially, a range of enabling functions. Those elements listed there are important across all the work we do in all of the delivery that we undertake, and we have an opportunity to integrate those more and ensure they're working for us to deliver against those key strategic aims, and those key areas of focus give us a way to test that out and to really ensure we're living by our agreed approaches and principles by making sure our system's working in how we deliver against those ambitions. Thank you. So that's sort of where we've got to and where we were in the framing of the strategy. So in terms now, we're moving swiftly to mobilise the work programmes to deliver the strategy aims and the opportunities identified, building on the work that already happens within the key areas of focus and the enablers now. We see this very much as a dynamic strategy moving forward, not something to just capture now a point in time, but to become how we work going forward. We want to ensure there's consistency in the approach and oversight of the work under those key areas and focus. And so we've identified some minimum outputs we want the leads to produce, aiming by the end of May, and we've listed those in the strategy so that we've got a way to assess what are quite different ambitions across the three areas, but there's opportunity to learn, and we thought that by identifying some consistency in that approach, that would help us to do that. But noting there are already groups in place leading this work across our system, so we're not having to set new areas of work up to drive that work. We are building on and accelerating the work of those programmes. We want to ensure that there's clarity of the arrangements and governance arrangements, in particular in making sure how actions are coordinated across our architecture, including with the health and wellbeing boards. And we're thinking about the resources we have in the system and how we ensure they're aligned to deliver the strategic key areas of focus. And recognising that all of this will need quite detailed stewardship, and the Integrated Place Exec is going to be the forum which oversees the implementation of the strategy on behalf of the ICB board, with partners there and reflecting the structures we have in place in terms of place partnership working and local places, so we're ensuring that connectivity to our populations and our local communities. Thank you. So now we're going to a few slides that are going to document the changes from the strategy draft that people saw here in February. So we've got some changes to the overall content and style of the document. The document now looks very different to the draft strategy, and thanks to Sean and the team who've added photographs, infographics, and hopefully really brought that document to life and feel it really reflects Derby and Derbyshire in terms of the people that are shown in those photographs and reflect our communities. And we've also included examples of good practice covering the areas of focus and enables, again, that building on what we do well. We thought it was really important to draw out and highlight some of the great examples where we are already working in the ways that we're aspiring to and we can learn from. And once approved, we will make the strategy more accessible to the wider public by producing a short form and an easy read version which will help us when we're undertaking work on engagement and implementation, recognising at the moment it's quite a detailed document. Thank you. The last three slides reflect the main changes made to the document section by section, and we've added some draft I statements into section 1, which intended to indicate what matters to citizens in relation to integrated care, so trying to translate those ambitions into things that make a difference to people and capture what's important to people. We've produced them using insights from local and national work already undertaken, and sources for them are included in the document, along with the planned next steps about how we confirm those. Much of section 2, the strategic context, is similar to the draft. However, we now reference primary care and carer strategies in the section, as opposed to we previously had those in enablers, so we've made sure that that's included in that strategic context, really important areas of work. And in section 3, population health and care needs, we've updated, reordered and reformatted the information, trying to be clear on what we need to aim for as a result of this strategy. And there's also some progress in the children and young people priority section, where we've linked in the +5, there's core +5 key priorities to tackle inequalities included in the strategy. Thank you. And the next set of changes are highlighted there in terms of some of the confirmation of the wording, how we've included the links to the knowledge and intelligence capability and commissioning, etc. And we've also identified a need for broader and more forensic approach to that knowledge and intelligence capability, including population health management. With regards to engagement with the public, you might recall we have as I mentioned earlier, we have a comms and engagement group specifically for integrated care with reps from health, local authorities, Health Watch and the VCSE Alliance. And that group has overseen the development of the insights document that pulls together insights gathers over many years into one place and highlights the high-level themes for consideration by system and programme leaders, and was used by the senior responsible officers for each of those areas and the teams to draw that evidence base for the selection of the key areas of focus. We've tried really hard to draw on what we know already, what people have told us and often repeatedly told us about what's important to them, and drawn that through rather than go out and create that. We want to now build on that with the work that's been pulled together already. And that group is overseeing the approach to more detailed engagement with the public on the key areas of focus, and we've got a dedicated space on the Joined Up Care Derbyshire digital platform, and we're running some briefing and discussion events next month. And engagement after these events will develop based on feedback from attendees. So we'll build that engagement, building on what we hear from those sessions and feedback through the digital platform. And we envisage that there'll be more in-depth and bespoke methods of engagement developed in line with the needs of those key areas. And as I say, they are quite different, and that we'll build that the most appropriate route as we progress with those areas. And we have also, and a point noted previously and really valid, we've noted the actions to help avoid digital exclusion, recognising that we're starting this with a digital platform and also some online events, and that's all right for an initial step, but really, really important that we then build out from that and make sure that we're not excluding any groups, particularly those vulnerable groups whose voice we want to hear, by the fact that we are conducting any of it digitally. And then finally, we've considered about evaluation and how we, as the next slide, final slide, thank you. We've had a task and finish group working on this to think about how will we know we're making a difference, and we've used the Social Care Institute for Excellence model, which groups opportunities into and ways of evaluation under experience, both citizens, users of services and staff, really important to hear all of those, and then service metrics looking at those population health indicators, as well as the more traditional service performance metrics that we tend to do. How do we draw those wider metrics together to think about the impact of the service? And then finally, and probably the most challenging but really important in terms of this partnership's ways of working, in terms of system impact. So have we, the things that we heard from people about why we don't always make the progress we do now at the pace we'd like to, in terms of working as an integrated system. The things we heard, as well as the enablers, which we focused on, was around things like the processes for decision making, the fact that the resources might be in one area where priorities are in another. How do we improve efficiency and focus on efficiency by working together? So those felt like to be real opportunities for us as a system to deliver against ambitions in an integrated way, and to do it differently by working together. And we want to find ways to evaluate that really hard, as I say, and ideas welcomed, and we'll be building on this in terms of how this forum, this partnership, would reflect on whether we're making a difference and making progress with any of those key areas, as well as hearing and understanding the experience and the service measures that we'll be looking at. So that's the conclusion of the presentation in terms of the context, the changes. Hopefully people saw the really glossy and engaging document that we circulated round in advance of the meeting. So happy to take any questions, and we'd like to request that the ICP recommends the strategy for approval in line with partnership members and with delegation to relevant directors if we need any minor amendments. And I think Robin was at, as we've been doing a range of engagements, talking to a range of forums around the strategy, and Robin was at the scrutiny committee last night. I think it's got some final comments that we can incorporate as well today.
Thank you. And yes, we discussed, I took the strategy to the scrutiny committee yesterday evening, and generally they were very happy with the draft strategy. There were a few areas that they wanted to highlight. One was particularly around when we talk about engagement, how we do this in a way that's accessible to members of the public. I think there were some comments around the use of acronyms within the document, but also when a member of the public looks at it, what will they feel will be different? What will change because of this work? And I need to develop that a little bit more. And the committee were really keen to have a further conversation later once we have that a little bit more defined as well. There was a specific concern that they raised regarding diet and food, and I'll be taking that forward as far as integrating that within some of the plans, particularly from the children and also from the working age adults work as well around cancer, cardiovascular disease. So I'll certainly take that forward. But yes, thank you.
Thank you. First of all, again, to just commend the strategy and thank you again for the way in which the voluntary sector views have been fully incorporated in here. It's quite amazing. Thank you. In 4.3 of the integrated care strategy, the system shared purpose and values principles and behaviours. So again, particularly in this case, thank you that this has been included. It's probably been the thing missing in the past that might have been the cohesion to take things forward. Thank you for that. And we would just like to request that co-production and in particular co-design may be written into there to just really highlight the fact that as part of those changed behaviours that this will be integral. There's been some very good examples already starting to come out, which is wonderful, where co-design is just starting to show its head a bit here and there. And the list is already going too long to share it here now because it's good news. We would just like to, there's still concern remaining in the sector that too many things are coming out that are not involving co-design, and the changes being made now are so important that it's the concrete's going to set. So please, a strong appeal that any initiatives that come out, JUCD, etc., any others commissioning, that co-design is undertaken with the sector. It's a bit foreign compared to commissioning practice. We know this, but we also know those practices need to shift where as much as they can that direction. Thank you very much.
I'm very happy with the Place Board overseeing this. I just need to think about how that relates to the ICB, because some of the issues that this will be taking forward are really important for the NHS's delivery. I mean, supporting people with long-term conditions so that we avoid unplanned admissions into A&E is a fairly obvious example. At the same time, some of the stuff the NHS is going to be doing should be very important in terms of health inequalities, and we've seen some of that in terms of how services are being delivered. So just think through, this is an old theme of mine, sorry, but I just think we need to think through how we make sure that that's not forgotten and it doesn't just come here. Is that all right?
I just wonder if I could respond to that. I think that the requirement of the joint forward plan, which I think I was going to be updated on in a moment, one of the requirements of that plan is to show the implementation. So I think that gives us the opportunity to draw from the the Integrated Care Strategy, the actions for the NHS, the implications for the NHS, as well as aligning it with the longer term plans of the NHS. So I think, John, that will give us the opportunity, but really important. Yeah, thank you for flagging that, but I think that's where it would.
And one other thing, I don't know what discussions there have been about trying to sort of take this out to the public, but I think stories and things like that are really important. Most of the public don't read documents like this. I can't entirely blame them, but I think the more we can do that, the better people might understand about what will be different.
Yeah, thank you. And probably my point follows on actually neatly from John's, in that there's something for me about, we talk a lot about obviously engaging with the public and making sure that the public can understand what's going to change. I think there is something we need to do within all of our organisations so that our staff actually understand this. Because certainly I was at a couple of things, I suppose. I was at a Place Alliance, Chesterfield Place Alliance, and we had a discussion, the document came, but actually I had expected that people around the table through their organisations would know more about the development of the document, but actually they didn't. And I don't know whether that was surprising to people around the table or not, but they were starting to say, well, why have these things been chosen? Why are these the areas of focus? And I was able to say, because I come to this group, well, I know that the people that have worked on this have spent a lot of time looking at data. It's underpinned by, really, really good analysis. But it kind of brought it home to me that actually there's a massive number of people that we need to understand what this is about, because actually they will be the advocates with the patients and the public in telling them what's happening. And if they can't get behind it, then, so I think there are two messages to give there. So yeah, I think that's the key thing. The other thing I think is that certainly I will take away and consider for Chesterfield, actually, what does this mean for Chesterfield Borough Council, and what do we need to include in our plans, similar to the way John's talking about the ICB, but what do we as an organisation need to understand about this, and where do we need to make sure we're feeding people in that we can deliver and help the best? And I think there's something for everyone to just think about how we roll that out. Thank you.
God, I've forgotten my microphone. Sorry about that. Right, thanks very much, Kate. That was good. So now we've got another big document. Takes some ploughing through, doesn't it? Joint forward plan. So Zora, you're standing in for Chris, I believe. So over to you. Thank you.
Thank you, Chair. Good afternoon, everyone. I've also got a bit of a cough myself, so hopefully I've got some water, but it should be okay. So yes, just on behalf of Chris, just wanting to set out a bit of information for the ICP around the work we're doing on the joint forward plan. If I could have the first slide, please. I think this might help just in terms of, and apologies, some of the print is a bit small, but just trying to set out this sort of connections between things. John's obviously alluded to this about how different strategies fit together. Kate's obviously just taken us through the integrated care strategy, and as you can see on the diagram, we've got a bit of a flow chart of the connections between some of the different things that we often interchange between plans and strategies and other things. So just very briefly, the bits I wanted to draw out is obviously we've got the integrated care strategy and very much see that as that single strategy for our broader partnership. But as part of that and this interconnection between the ICP and the ICB, we also have the joint forward plan, and obviously the point of the slides and the presentation this afternoon will just be to take you through what that is and the work that we're doing to progress that. But you can see that there is obviously that connection I've just described. There's also the connection between the joint forward plan and our health and wellbeing board strategies as well. And we've had a similar presentation at both of our health and wellbeing boards just to talk through the process and make sure that we've got that connection and alignment. And we mustn't forget, obviously, that the organisations and partnerships that make up the broader ICP absolutely have their own strategies and plans as well. And our role is to make sure that those things coexist well together and that alignment to the overarching strategic priorities of the system are clear and understood, regardless of what role you play or what sort of stakeholder you might be in delivery or benefiting from those strategies. If I could have the next slide, please. Thank you. So if you don't mind, I'll call the Joint Forward Plan the JFP, just for abbreviation's sake. So the JFP itself is an ICB requirement. We have very clear guidance as well from NHS England about the requirement to set out a 5-year plan of how we will go about meeting the needs of our local population from a physical and mental health perspective. We obviously have a lot of statutory duties and what I call sort of must-dos, which need to be really clearly set out for the public to understand, to show how we are meeting those key requirements. But also, and this is where I think this is different to some of the previous strategies and plans that we've developed, is that there's a real localism to it, that we have the ability without constraint to set out actually what those local priorities are and what we really want to focus on for the city and county from a Derby and Derbyshire perspective. It's very much jointly owned between the ICB as an organisation, but also the partner trusts that make up that broader NHS family. And what we're also seeking to do, particularly linked to the integrated care strategy and the work of our health and wellbeing boards, is to connect all of these things together. So we'll be really clear on the requirements and the things we will deliver as an NHS and as an ICB, but importantly, that connection between that and the broader ICS delivery as well. I'll come on to some of the other bullet points a bit later around sort of consultation and engagement and those sorts of things, but the other point probably from here to make is that NHS England role. So we will be supported by NHS England to produce the documentation and they'll give us advice and support along the way, but it's not being seen as a sort of formal assurance process, which I think is really important to give us that local flexibility in how we create this going forward. Could I have the next slide? Thank you. Again, I'm not going to go through lots of detail here. We'll share the slides, but a lot of this is within the paperwork that you received in advance of the meeting. So this really just summarises the specifics that are set out in the guidance that you do have a copy of. So that sort of balance between things that are set out in our Health and Care Act and the things that we need to produce with the flexibility that I've just described. We need to obviously sign off the produced output, and I'll come on to some of the detail in the process around that. And we'd obviously be seeking key support in signing that off between our partners of the ICB, but also here and with our health and wellbeing boards as well. If I could have the next slide, thank you. So 3 overarching principles of the JFP. We must absolutely be fully aligned with those wider system partnership ambitions. So as you'd expect, myself and Kate and colleagues work closely together to make sure that what's set out in the integrated care strategy, for example, is very much reflected in the JFP and vice versa. So we're really clear about those connections and the different roles and responsibilities. There's also that sort of doing things at the most local level possible, which is where the local sort of strategies and flexibility comes in here to say, yes, there's lots of national must-dos that the NHS must absolutely deliver and are really important in their own right, but locally we will try and do things as close to communities as we can. That's a really key central theme here. And then the bit which I think is certainly reflected from an NHS perspective that we often struggle with, although we intend to do it, is that real sort of hard-edged delivery focus, the really tangible objectives beyond the good narrative and the descriptions of things we want to do. Actually, specifically, what does that boil down to? What would be the trajectories? What would be those milestones? So that also needs to be really clear within the JFP that we produce. Thank you. This diagram is trying to, I suppose in a different way, bring to life some of the things I've started to describe about how we've got the integrated care strategy. We've got the NHS requirements often sitting in what we call operational plans and our planning guidance that we receive on an annual basis, and how all of those things knit together when we look at the overarching strategic priorities of our health and wellbeing boards and also of Joined Up Care Derbyshire. So hopefully that just shows how, whilst we've got separate plans and documents that we can point to, they actually all have quite a common theme and thread around what we're doing around population health outcomes, life expectancy, enabling healthy lives, and all the sort of operational requirements that sit around that as well. Thank you. So just talking a little bit about process now. So on the left-hand side of this document, it sets out the sort of key content areas, and as I speak, colleagues are working through just really starting to flesh out the content here, but essentially what we're doing is setting out clearly those must-dos, those national priorities and duties, how we respond to those. That will be clearly set out within the JFP. The consideration of our broader health and wellbeing strategies and that alignment to the integrated care strategy. And then because this is a 5-year plan for the ICB, we've obviously, and we're just in the process, hopefully in the next sort of couple of weeks of finalising our 23-24 operational plan. That very much is being seen as year 1. So we have a lot more granular detail, as you'd expect, of what year 1 looks like. What we now need to do over the coming weeks is say what year 2 to 5 looks like and start building on that. So we're really clear from an operational and strategic perspective what we expect to deliver and what those impacts and outcomes will be. And then on the right-hand side of the diagram, you can just see just some of the steps that are in train in order to make sure that we meet those various tests. And then, as you'd expect, we have on the far right-hand of the diagram just some of the governance, and it's far more detailed than this, but at a very high level, some of the steps we're taking. We've got a working group in place with representatives across our partnership who are helping us to do the work and to steer it accordingly. And then, obviously, we've got plans around stakeholder engagement, and Sean and team are helping to plot that out at the moment. And then the sort of formal governance to have draft and final versions shared with respective boards and bodies. Thank you. So the engagement approach, so very much, I know it's often an overused term probably, but that co-production is really important. So we want to make sure that through that engagement work that we've got a really robust framework that people recognise, and they recognise the content that we start to pull together. We've had initial conversations, I think I mentioned earlier, with the health and wellbeing boards, and obviously we're starting to have the conversation here today as well. So between now and the end of June, we just want to be clear with colleagues about what people might want to see and how we take that forward. Won't read through all the other bullet points, but the key points is that we've got a lot of ICB governance wrapped around this from different perspectives, which is important. We will start to think about any public consultation requirements and engagement that we want to do with the public and other stakeholders as the plans develop. and importantly, what sort of any risks that come out of some of these conversations and how we manage the impact of those things. And whilst doing all that, being really clear what that JFP means for individuals and different groups, regardless of who you are and what role you play. Thank you. So the framework itself then, we will be developing it and badging it as an ICB plan because we need to be really clear what the ICB needs to deliver, but very much, obviously, that granular level of detail will be probably in the first couple of years with sort of more of a sort of overview of the years that follow and that being worked through over the months ahead. We'll definitely be making sure we've got that blend of the national and the local priorities. And we do have a very draft content that we have that we're working through now, but very much in the next few weeks, and we've got a milestone in early May to have a first good working draft that we'll start to socialise further. Thank you. So some of those local priorities, and I've mentioned this a few times, so what could those be? So absolutely building on the year one plan that we've already got, so things around access, prevention, how we can be as productive as we can is really important. And if we think particularly from a sort of NHS and social care perspective, there are lots of risks we manage on a daily basis around urgent and emergency care and also our planned care as well, and the impacts between the two. So that's really important to pull out. There's a really important strand here around the priorities that Kate's just outlined that are already within the ICS strategy. So again, we're building on some of that and being clear what the ICB response is and ICB delivery will be rather than replicating or confusing or duplicating. And then those tangible actions that we want to get into play. I think the health inequalities side of things is quite challenging because we know the areas we need to look at, we know the things we're starting to work on, but how can we have the highest possible impact? That's certainly something we want to work on with our partners. And then the population health approach, which obviously links to reducing our health inequalities as well. So working as broadly as we can, particularly across our primary care networks and with places as well, to be really clear what those targeted improvements are that we're already working on that we want to recognise, but also other things that we might want to do as well. Thank you. So just getting towards the end now. So just a bit of a sort of, if you're more of a visual person than the written form, then you can just see here a bit of a structure to some of, excuse me, some of the things that that we'll be setting out within the documentation. And then just the next slide, thank you. And this is where we are really looking for people's support and advice and feedback. So those local priorities that I've just talked about, are they the right sorts of things? How we go about prioritising as well, because actually, whilst we have frameworks in place, particularly we certainly have those in the NHS in play, but what's the sort of broader partnership approach to prioritisation that might look like? And then also just setting out, you know, what those 5-year milestones might be and being as tangible as we can, as well as those success measures as well, and working with all partners in that respect. And I think there might be one or two more slides. So I just think actually this is the last one. So yes, so happy to take any feedback that people have, and obviously we'll keep talking to people. It's not a one-off conversation. We'll continue this over coming weeks before we need to publish a document at the end of June. But there's some questions here that might be helpful for people just around the thoughts that you might have had while I was just doing the presentation, your views on the approach, those local priorities specifically, and also that sort of engagement work that you and your colleagues might wish to be part of as we progress on this journey together. Thank you.
Thank you very much. I had to try and plough through it, because when we're on about acronyms, it's yeah, you get mind-boggling. Just a sort of a general thing. The thing that I think that seems to be cropping up quite a lot is, I mean, I know you've got your statutory duties and things that you have got to do as NHS. One that's, you know, but you do mention prevention, and that I think is where local government particularly comes in on the prevention. And all the meetings that have been involved with them on a focus group now, organised by the LGA with different chairs and everything else, that is the one thing that keeps coming up. It's how, because prevention, the local authorities do most of the work on prevention, but the fact is they haven't got the budgets to do as much as they want. The NHS, the trouble is that if they put towards prevention, it doesn't always kick in for, you know, how many years. It could take years to actually start to kick in. But that is the main thing that keeps sort of coming forward when I've been in meetings. But I know it's a difficult one and we're all struggling with budgets, but I think that is the major area that I would talk about. Councillor Webb.
Yes, just to back that up, Chair, housing is one of those issues around population health management that really does have an impact, and we in local authorities have a responsibility with regard to housing, but we cannot do it alone. So as part of all these strategies, we really ought to be emphasising that not necessarily where people live, but how people live and the environment in which they live is going to be more and more important in improving our health inequalities and our health overall, so that the impact on the NHS is considerably reduced. I know I've banged on about this before, but housing is one of those essentials. We all need somewhere to live. We've just got to make sure that that environment in which we live does not have a serious impact on health.
Hi, thanks. One, there was a slide that sort of had primary care networks with a / replace alliances. And I guess it's that challenge if we're going to describe a joint forward plan that has those blurred together. I don't think it will help us move forward as a system. We need to probably put some effort into defining what that is to allow us to move forward. So I worry that that might hold us back a little bit. The second point was around the local priority areas, and this, a lot of work that I do is around priority areas. We sort of know what the health priority areas are because we've defined that within the integrated care strategy. What we need is local responses to address those priorities. And so the freedom to say, well, what are all the local priorities? It's a bit open sometimes. And I wonder actually, I know that in our different communities, we need different responses to address cardiovascular disease or circulatory disease, for example. So we need a slightly different approach. And then the third point was how we appropriately include the totality of primary care within the joint forward plan. Because if I think about the dental issues that our children face, which are really quite significant, that's not a general practice thing, that's the totality of primary care within a geography. And I think including that within this forward plan becomes a really important element. So sorry, 3 separate points, but I think important.
Thank you. Just a couple of points. Roy mentioning the housing did make me wonder whether there doesn't need to be quite an early conversation about the emerging health and wellbeing strategy, where I would see the housing element being a really strong part of that, and that in terms of the prevention and how those two plans then talk to each other. And then I think the last thing, just picking up on what gentleman was saying over there, is how do we involve place alliances in giving us that feedback around local priority as they see it? And I suppose for Chesterfield, we have a sort of a system framework that also includes our health and wellbeing partnership, but our community safety partnership, our skills and employment partnership, our locality. How do we have a conversation with those sorts of groups at that level to say what do they think, what are their priorities, and therefore what then can sort of feed into this more strategic piece? And it is difficult because, you know, there's just so many people involved, isn't there? But it just feels like that would be a good place to start. Thank you.
I think this is the problem in Derby and Derbyshire. It's such a massive, massive area. We've all got different priorities. I mean, you mentioned the health locality. I mean, that was really where I got to know Duncan, and that was through the COVID, pandemic. And we met with people that we hadn't been meeting with before, but we've got different, problems, say in Erewash, where I live, as perhaps Chesterfield or Derby City. So it's a massive, trying to wade through it. Yes, Helen, you want to speak?
Thank you. 11 days in, it's probably very early for me to be commenting on some of this, but I am going to anyhow. So I think there is, this could be seen as another plan that we've got to write in quite a short time scale, or it could be seen as an opportunity to add some impetus to our joint work in some areas. And I'm particularly keen, and having had some conversations in the last 11 days within Derbyshire, to really reflect on what we can do in this plan together, particularly around children and young people and their access to mental health. Seems to be a recurring theme in terms of, have we really got a joined up way of working? I think informal carers perhaps are an opportunity for us to really think about them through health inequalities, but also through your access, the things that you've got to talk about in terms of access to urgent care and electives. If we can have more conversation around that. I think there is also, particularly in some of the more rural parts of Derbyshire, and I'm struck by how little primary care is talked about. And I think there is a real opportunity to think, if we're looking at things through a place lens, think, is there something more that we can do together to go further, faster? So the big strategic plans are great, but through this, we might be able to just really focus on what can we do in the next 12 to 18 months, to actually change the outcomes and make the money go a bit further. So whilst it is quite a tight time scale, I do think it gives us an opportunity together. So I think it's really welcome.
Thank you. I think, just to add from my perspective, it feels this has very much started out as a joint approach and looking at how partners can be involved very much in the solutions. I think in terms of health inequality and prevention, the step again outside of local authority and statutory bodies is the voluntary and community sector. And obviously the voluntary community sector and communities are very much out there and impacting it in that space as well. So I think you're absolutely right that it is about how we bring all that together. And I do think this is an opportunity to do that through that work, and also, again, even more complicated, I know, but very much seeing the voluntary and community sector as a strategic partner in this space, I think, is absolutely pivotal in terms of having a real impact, particularly given the challenges that we know we have in terms of developing and then acting on and implementing our plans.
So first of all, on co-production, I just also wondered when you mentioned over there about the plan being able to take us into action, whether we could be putting, say, the more detailed aspects of co-production, like the co-design, co-delivery, co-learning, etc., under the guidelines, because looking at the guidelines, that looked like a quite good place for that as a backup to the main information that you got, which is perfect. So we just wondered about that. The second thing is asset mapping and leveraging. So it would seem that, so an example I've seen from somewhere else where you map, but not just the traditional asset mapping, you actually map what assets are delivering. Okay, so in terms of the budgets dropping and these issues and the changes being made, that by mapping what is out there by condition or area of work, we could move much more quickly into leveraging what's already there and actually be more productive, because you wouldn't need that full amount of money. You'd only need a percentage of it through the working together. So it gives a place where you hit the ground running. It gives something to actually start on and get going on. We've said before, we are told by other regions that Derbyshire has a very rich source of specialised BCSE provision. So if we map that along with others, all can have a go, but it gives you somewhere to start straight away. Thank you.
It's a good job you're here, Roy. Keeping John and I both in. One of the things that I think sometimes when you go away you know, sort of an hour or two later and you're sitting thinking about it, you know, what about that? Or so I'm sure you'd be quite pleased if anybody has got any more comments or want to add anything, please get in touch with Zara or Chris and I'm sure they'll take that on board. So we are asking out the report. It will be quite strange. I think that one of the things I think we've got to do, because we are going to have some new members on this partnership, I think we probably ought to set up some sort of information session to bring people up to date as to exactly what we're doing and where we're going. I know the timing, you know, we've got to keep going and, you know, you've got dates and times to get these strategies in place, but I do think that it's something that we perhaps need to do, so we can perhaps organise that. So if there's nothing else on that one, we'll move on to, which is the last item, which is items for information. Update on the Integrated Care Board from his last meeting as the chairman of the Care Board. So over to you, John.
Thank you, sir. The operational plan for this year, across the NHS, it hasn't yet been agreed, and the issue is the money. What a surprise. So this will continue this discussion until, I hope, early May, when it could be finalised. I think we know what we have to do, especially some of the gaps in that. So there's some quite intense discussion, not just here, right across the whole country. But that's important. The Hewitt review, which has come out, and this was a review of ICBs done by Derbyshire Hewitt, who was previous Secretary of State for Health. He is an ICB chair in Norfolk and Wales, I think. It doesn't add much, but it does reiterate some really important messages. I think that were there at the beginning and have been a bit watered down. And it has implications both for the ICB but also the ICP. So I think it's probably a bit early to look at it now. I think we need to wait and see the government's reaction to it. But I think at some stage it's probably something that should come here. And you know, a lot of it are messages to the centre about getting less controlling, etc. We'll have to see whether that will happen inside the election. But I think the message is one we all very much welcome. And finally, just to note the delegation of commissioning to pharmacy, optometry and dentistry this year. There's a whole lot more which Sarah will reel off if you want coming next year. There's quite a sort of complex arrangement being put in for this, but I do think that they provide some real opportunities to think about how those services are run, you know, what we want from those services, how it fits into place. We all know that pharmacists, for instance, have a considerably enhanced role that's been developing. So although the commissioning will be done collaboratively across the East Midlands, I think it's really important that we think about the context of that and what opportunities there may be, because up to now, those have been commissioned in a fairly mechanistic way, I would think. A lot of it's been done regionally or nationally. So we really need to take advantage of that, and I think that's something that the ICP needs to think about in terms of the context of the place, and we need to, there's potentially some real opportunities for that, and we should try and take advantage of it. I don't know, Zara, if there's anything else, but those are the 3 points I just wanted to highlight.
Any questions for John? No? I think really that's sorry, Duncan, over to you.
I just wanted to reiterate that point around the pharmacy, dentistry and optom and the opportunity to support preventative care. So they have an awful lot of contact with people who are often presenting at an early stage, and I think as a system and as an ICP, there's a huge opportunity to do what we set out within the strategic aims that we've just recommended around and prioritising that prevention. So I find that quite an exciting update. Thank you.
Thank you, Duncan. Can't see anybody else. So it's been a relatively short meeting, but we've been through some good paperwork and yeah, a lot of information. So I suppose really we're just sort of finish up by saying thank you, John, for all the work that you've done for us. For you know, it seems to be meeting regularly over quite a long period, haven't we? But we're finally there, and now we're there. You're leaving us, so but best of luck anyway. And wish you all the best for the two trusts that you know, like boards that you will be on. And Roy, thank you for your contribution. And if you pass on. We will drop a note, but thank Jill for her contribution because she's been very active member. I'm sorry she couldn't make the last one. So, and we'll see who comes to the next meeting. But as I say, I think we do need to get an information on, so get people up to speed, because it's an awful lot of work been going on, and when you've been involved for a long while, you know, you sort of take it all on board. But for somebody to come in completely new, yes, it's going to take some doing. So, thank you for attendance and declare the meeting closed. Thank you.
Sorry. Well, and I've learnt a lot. Duncan often used to start a comment at the board about, I see how people think very differently to me. And you knew then that he was going to come up with a completely different perspective on things. And actually, those conversations were often the most enlightening. So thank you all for your work. And I've really enjoyed it here. And I'm sorry to be moving on.